I think this is a community, what I've realized, they really care about this hospital. Not only just the care that happens here, but even just the institution, its history.
BusinessJournalDaily.com. 3 Minutes With is brought to you by Farmers National Bank.
Save, borrow, and invest with Farmers. Take heart knowing you're helping create a strong community. Mind your money at Farmers. Talk directly to local decision makers about your loans, investments, and insurance. Farmers. Fiercely local, fiercely loyal.
I am so delighted to have the opportunity to welcome you here to Insight Hospital and Medical Center, Trumbull, where our doors are open for business and we continue to take great care, high quality care of this community and the patients we serve as we have for over 115 years. We are delighted because Hillside as well is open and serving the needs of the community. You know, both organizations have gone through a lot of changes over the years, but I think probably one of the most challenging was this year between the bankruptcy and the closure notices we received. However, through that time, it's been the loyal commitment of the community here, including our elected officials, both at the local, county, and state level, several who are with us today, as well as the businesses, our board of directors, and especially the dedicated staff here at Trumbull and Hillside, and our skilled medical staff that has continued to have these organizations running. And we have a commitment, Jamie and I and the rest of the team, to continue to serve the needs of this community across the continuum of care together.
I think this is a community, what I've realized, they really care about this hospital. Not only just the care that happens here, but even just the institution, its history. And I've seen that in the nurses, I've seen that in the physicians, I've seen that in the general staff, in the elected officials. And it's very, very refreshing and exciting to me to see that and feel that. And I don't know what's happening in Warren, Ohio that allows that to happen, that energy to be there, but it's very special. I don't think the community should, I think it should be proud of what it's achieved in terms of that energy. It's really something special. We have a lot of challenges that are regulatory, that are financial, that are clinical. But among some of the wins that I think that are very important is, number one, is that we converting to a 501c3. By becoming a charitable hospital, it allows us to unlock so many resources now, whether it's federal programs, grants, et cetera, et cetera. So it allows us to open that door now. So I feel the conversion into an entity that can be, positioned for success is very important. Beyond that, the fact that the staff has been stabilized, where we are not seeing that efflux of nurses and staff at the rate that was happening before. Stabilizing the staff, I believe that was a wonderful win for us as well. We've introduced new services, as you noted, neurology, neurosurgery, and we're growing in terms of every single division at this point. So the supply chain being stabilized has increased the volume in the operating rooms, and I feel that we were at a point that had this gone on another couple of weeks, I think the hospital would have been irreversibly damaged. The fact that just at that kind of moment, the community came together, allowed this to happen, changed that trajectory, and I'm very excited about that. I think those are some of the bigger accomplishments. Sharon Regional, I went there this morning to go and look at the hospital, and I understand that the community is hurting and needs help and support and so on. I can say that we would definitely be interested in helping if we really are needed in that community. And if this is something that the community really wants of us or expects of us, it's something that we would consider, because Sharon was integrated with these other hospitals. I don't feel comfortable walking away from the hospital, but at the same time I understand there is leadership, management in place. There's other elements to the community that I don't want to get in the middle of, where perhaps it's a better solution than us. In my personal assessment of the hospital is that I do think it's needed in the community, and it's needed to function properly as a full hospital. So in terms of what we would be willing to do, as I say, there's multiple different people or different groups that are involved, that we don't want to get in the way of anyone's desire to run that hospital. But at the end, if it's something that falls on our plate where we have to do it or we are in a position to do it, then we wouldn't rule it out. In terms of what would change now, first and foremost, our goal is stability. So that's all we're really focused on. But in terms of what I would envision changing is that we have our perception of what's needed here in the community as acute care critical elements of the hospital. As I mentioned, neurology, neurosurgery, cardiology, there's certain things that I think we need to enhance. Urology is a big one. The community has not had full urology coverage for a couple of years. So that's a very critical element. So these are critical things we would add. From there, we would go to areas that we think would be a nice enhancements for training purposes, for something that beautifies the hospital in terms of advanced services that we can offer that others don't offer. So we're looking at a variety of different elements of it. And I have to also say that part of, though you're speaking to us and the community looks at us as hospital operators, a big part of our mission is to go deep into the communities and help with the social determinants of health. And that's a big part of what we'd like to do here, that put our advanced programs in for the youth, and let's see if we can cause a dent in the trajectory of young people from difficult circumstances such that they can enter to the economy and so on. So we have multiple programs for tutoring, for sports. We want to work with the community and see if we can also help at that primordial beginning level of a life trajectory. And I think that's where real impact and change can happen.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
Save, borrow, and invest with Farmers. Take heart knowing you're helping create a strong community. Mind your money at Farmers. Talk directly to local decision makers about your loans, investments, and insurance. Farmers. Fiercely local, fiercely loyal.